the WHO, CDC, UNICEF, USAID, and the GIZ. He's also a nutritionist researcher of improving the nutritional status of women and children. He graduated with a master's in public health in December 2020 from the Ghana Institute of Management and Public Administration. He has a postgraduate diploma in education. In September 2011, he graduated from the James Lind Institute, Switzerland, with a postgraduate diploma in dietetics. He also has a BSc in community health from the University of Development Studies, Tamale. He worked as a nutritionist at the La General Hospital and also as an instructor for biological sciences at the Talent Restoration Academy, Ghana. He has various publications and research outputs on a wide range of topics, ranging from food safety to dietary practices, alcoholism in women, and among others. Currently, he's the programs manager for Linkages Africa, Ghana. He is also the principal district nutritionist and training coordinator for the North Dai district. Ladies and gentlemen, with a virtual round of applause, let's welcome Mr. David Teko.
All right, so good afternoon to everybody. Thanks so much for having me. Once again, I would like to humbly thank the Ghana Academy of Nutrition and Dietetics. I think it's a very noble academy. We can only just help to ensure that the ultimate objective of this important group will be realized. And so I would kindly like to entreat all of us who are currently gathered here to also try as much as possible to, as it were, convince our other colleagues who are still sitting on the fence. I think this is a group that we all need to belong to. And so it is important that we take very important steps to convince other people to also join. So, Madam Moderator, thanks so much once again for having me. And with your permission, I would like to kickstart our brief discussion for today. Okay, so for the purposes of today, we'll be looking at anemia prevention and control. Anemia prevention and control. Most often than not, when it's time for presentations like this, we always want to look at it sometimes from the academic point of view. So sometimes you get back to the field and you realize that there are some theories that are not so relevant as it were to some of the contemporary practices that we have. I'm also well aware that the audience that we have today have so much knowledge in some of these things. And so I'm not going to belabor that point at all. I'm just going to go straight to some of the few things. My aim is to bring the practicality of the things to light. What are some of the challenges that we face as practitioners on the field? And together, let's discuss, or let's have a discussion as to how we can move this particular topic forward, because over the years, anemia has been a thorn in the flesh of the communities that we work in. I call it an albatross because we tried several times to see how the rates or the prevalence of anemia, especially among the pregnant women, whether at registration or at 36 weeks, could easily go down, but sometimes it becomes very difficult. We've had a lot of discussions around it, but it's still very elusive at the point. And data has backed it as well. And so it's very necessary that we look at it in a holistic way. What role can each of us play? What views is another person also having? to see how we can all bring these things into perspective. So obviously, as I indicated earlier, it is not an academic exercise. I'm just bringing my perspective to bear on some of those issues. Obviously, as a result of the rapid growth or rapid spurts of growth that are seen in children, we know that definitely the requirements for iron are also going to increase at the point, and especially even for pregnant women, we are so much aware that because of the increase in the blood volume, obviously the requirements for iron are also going to increase. And so it puts some of those people mostly at risk of anemia, which mostly in a layman's form, we have to look at it as a reduction in the number of the red blood cells, especially the hemoglobin concentration lower than normal. But of importance is what the World Body also says. The WHO, we know, estimates that about 42% of children less than 5 years of age and about 40% of pregnant women worldwide are anemic. And especially so when we know the debilitating effects of this particular condition, some of the very, very devastating effects of anemia. And so it begs the question, what really can be done about this particular thing? Because if you are having about close to 4 out of 10 of your children less than 5 years being anemic, and even when it comes to pregnancy, about 4 out of 10 of our pregnant women still anemic, then it becomes something that we all need to look at and see what really, could be done. So if that is what the World Health Organization is saying, that is backed by data, we all know how WHO operates already. They pick country-specific data and work around it. But then a closer look at the Ghana Demographic and Health Survey report, the latest one, also backs precisely what the WHO is also saying. And in fact, even for the GDHS report, the latest one, you notice that nearly 6 out of 10 children that are between 6 to 59 months in Ghana are anemic. And so even from the year 2003 through to 2008 and through to 2014, in as much as the rates of anemia in Ghana has reduced a little, you still notice that the rate that we find it is still relatively unacceptable. But if you look at the classification of anemia that we have in terms of its public health significance, you notice that if a country specific or if a population has about greater than or equal to 40%, then that means severe public health problem. I was talking to a colleague of mine and I told him that then it means that by this time UN helicopters should have been flying over Ghana, because the rate that we are witnessing in Ghana is just, somebody would say, is becoming unbecoming, because 42% among your WIFA, that is a very dangerous thing. But the question that we need to find, or we need to ask ourselves once again, is what are the main causes of this? Or what could really be the problem? Or what could be done about this? As practitioners, anytime that we see this sort of rates, especially for those of us who are a bit much more tilted towards the public health aspects, we notice that no, there could be other varying factors that could actually be responsible for this. And so this perspective that I'm bringing today is just look at really what are the things that exist in our various communities, what are the challenges or the bottlenecks, and what really can be done about it. Obviously, I'm sure all of us, when we see somebody who is anemic, at least the clinical science will tell us a lot. When somebody is having from fatigue to headache and even to lack of sleep, or mostly due to how infrequent oxygen is moved around, or the low levels of oxygen that is being moved around, mostly because of the low HB, which is indicative of the anemia that we are trying to look at. But then imagine that somebody comes to you in the consulting room, or as a dietitian or as a nutritionist. The first things that we are mostly going to look at is what are some of the risk factors. We need to assess the risk factors. Is the person that is in front of us presenting himself or herself with some risk factors? So obviously, poor diet will always come up. As for anemia, I remembered when some of us were posted into the service, anytime that the rates of anemia seems very high, the first thing that your director will ask you, or your medical director is going to ask you is, but anemia is always diet related. But we all know that it's not always the case. I sincerely feel from my experience that we need a whole deep research on this whole anemia thing, because the data sometimes is quite difficult to believe sometimes. So obviously, we need to assess the risk factors, as I said earlier. So poor diet will always come in handy at first. Is the person having some intestinal problems? We know so well the impact of menstruation, especially for our dear females, what it has on the development of anemia and all those. And even with menopause, a lot of literature have even suggested that because of the low estrogen levels that are indicative of such a period, that could also affect the way the body uses iron. So low estrogen levels obviously will affect the way the body uses iron. So even when you are in the peri or the main menopause, which is normally after a year, and then post the menopause too, you are still at a very high risk of anemia. Pregnancy and its related issues, very, very, very significant on that. And even high parity, we see that a lot in most of the communities that we work in, especially the number of children that a family chooses to have, and even the spacing, the birth spacing between the children. If you look at even our family planning rates currently, the Ghana Health Service sets its family planning target around 40%. That is for new and continuing acceptors. But currently, we are still performing lower than that. Our current rates is around 30%. And so obviously, it's a significant fact that there's high parity in the system. People who have 9 children, 10 children, sometimes because of how we're socialized and all those things. So all those things will also have a part to play in this anemia discussion that we are having. The cancer and the kidney failure, that is a chronic diseases, we all know already. People who have kidney issues, obviously, you are going to have a low EPO. So if you have a low EPO, obviously, your RBC count is surely going to be very down. And so obviously, that is also another risk factor, aside the genetic factors and then alcoholism. Alcoholism, I carried the research on that, and it will amaze you how women are now overtaking men in terms of alcoholism in some of the communities that we work. By dawn, you see a lot of women, some even in their reproductive ages, abusing a lot of alcohol. And how that then works, the mechanism that alcoholism works in terms of anemia. Obviously, in terms of the bone marrow and the rest, the precursors are all going to be deactivated. And so it has some level of impact on how blood is produced and all those things. And so general causes, like I said earlier, we are not going to belabor ourselves on some of those things. We know a lot already when it comes to this. But for me, significant, again, is the fact that anemia in itself could be a warning sign of other serious health conditions, which is so necessary, again, that we all pay so much attention to. A lot of academics or a lot of practitioners would like to categorize a whole anemia based on the size of the red blood cells, or even the duration of the condition, or sometimes even the cause of it. But at the end of the day, anemia remains anemia. And that is why I'm just looking at the perspective clinical and the public health aspect. Let's just look at it. Okay, so we all need to recognize the fact that in as much as there are a lot of causes of anemia, definitely what comes into mind is what then are the immediate causes. And as long as we have immediate causes, then it means that we obviously also could have underlying causes of some of these things. So first on the list, as always, as I indicated earlier, anytime that anemia comes into mind, the first thing that would always come into mind is, oh, this one is nutrition related, this one is dietary related. But we all know that there could be other genetic factors. There could be a lot of factors that are responsible for that. So obviously, when you do your assessment, even when you assess the risk factors, which we looked at earlier, you may want to look at the dietary intake of the person as well. And we all know in this part of the world, and in fact, globally, iron deficiency anemia is the most popular. And so that is why a lot of people feel that as long as there's iron deficiency anemia, let's all focus our attention on that, though there could be other ones as well. Malabsorption, especially that occurs when there are diarrheal situations, could also be one major precursor of those things. Infection, and I intentionally mentioned malaria because as for Ghana, we are already endemic. And so obviously malaria would definitely be one of the key points, and all other interventions that our service would supply or would give opportunity for, worm infestation and all those things will obviously have an impact, or will obviously cause or lead to anemia. But now this is the crux of what I'm trying to say. So we looked at the immediate causes, and as I indicated earlier, most of them are things that we know, because I don't think we need to tell a nutritionist now that this is the cause of anemia, this is this. No, we all know that already. But the social perspective of what this condition is all that I'm trying to look at. So for instance, when somebody comes to you in a consulting room, or somebody comes to you with this particular condition, or somebody's referred to you, it's not just looking at the immediate causes of the thing, okay, no. But at the end of the day, we need to look at, okay, so what is actually causing those, into quote, immediate causes? For most often than not, we would have noticed that the underlying causes that we are trying to look at would obviously be falling under one of those 5 categories that we've listed. And this is so much backed with data and research. Sometimes it is just due to ignorance of the people, except that they don't know how to combine their meals well, or is that they don't know about their condition earlier. Sometimes it's about their educational level. And sometimes it's about their socioeconomic status. Somebody will tell you, okay, so you are telling me to buy this or to do this, but I don't have the economics. I don't have the money to be able to afford this. And obviously, if you are looking at availability of food, then you also need to be looking at how accessible the food is, and even how affordable the food is for the people. Are we able to tell that the people that come to us are either having the economic power to do what we ask them to do, and sometimes also the cultural practices and the belief systems. We all come from societies where there are even some taboos. We come from societies where some categories of people are not allowed to eat some particular meals. And so all those things come into perspective if we need to offer or prefer a very significant health education, or we need to tell people precisely what they need to be doing in order to prevent or control this condition that has really dealt with a lot of people. At a point in time, I'm sure all of us may have felt some pangs of anemia at a point, which could be due to varied reasons. But the important thing that I'm trying to bring out today is that as people come to us, or as we go out to talk to people about anemia and the rest, how to prevent, how to control it, the important thing for me is that we need to look at the root cause of all these things. Obviously, when we are looking at iron deficiency anemia and you are trying to place it on, let's say, a dietary reform or a dietary regimen, you need to ask yourself first and foremost, what is the level, the background level of the person that you are dealing with? What are some of the cultural practices and beliefs? Like I said, we know so well that in some of our communities, even, you are not allowed to eat some eggs. You're not allowed. Even some particular meats you're not supposed to take. There are some particular foods that you are not supposed to take. And in some particular communities, even, there are people, even in a household, intra-household, there are some particular people who eat some particular types of food as compared to some people. So you realize that even in a particular household, let me just digress a little, you can even feel the effect of the triple burden of malnutrition in one particular household, in a sense that in some of our households, if I may say, we all know that, yes, men for a lot of reasons, may not be people who are so much at risk of anemia, because we always put it down to women or pregnant women and then children. But the question is, in most of our local settings, the man is always seen as the head as well. If the man is the one that is providing food for the house and all those things, we've all observed it before, how the man is treated always like a king. And then the people who rather need those sort of proteins are even deprived of that. And so even in one particular household, you realize that the status may be different for a lot of people. People may even be at risk in that same household that somebody is not at risk at, because of some of our belief system. They say children don't eat this type of food. Women, if you are pregnant, you're not supposed to eat this. Otherwise, this thing will happen to you. It is only the man that is supposed to eat this. And so sometimes when people come to us as practitioners, we tend to be telling them something different from what really is bothering them. Because you are telling somebody, when you are telling a woman, for instance, if you go to the house, make sure you eat this, make sure you eat that. But the prevailing political situations in the house are in variance with what you are trying to tell the person. So it is very imperative that you look at some of those 5 pointers that I'm also trying to look at in terms of the public health aspect, where you try to analyze these things as well, so that together yourself and then the patient or the client will be able to tailor something that the client can easily deal with, so that together we all can have a very, very, very good outcome of what we wanted to do. So in terms of prevention, obviously, we all know about the food-based approaches already. Like I said, I wouldn't bother so much into some of those things. The food fortification issues, a lot of issues have been made about this, dietary diversification. I think for some time now, most of our communities, and frankly speaking, we have a lot of very nutritious meals, locally made meals at our end or in most of our communities, except that most of them are not so. People feel inferior when they are even using some of those things. Now, it is almost like somebody will say a swag if you go to a place and you're able to order for this, and that. But I believe strongly that for those of us who are mostly at the community settings and all those things, there are specific food samples that could easily be found in some of the communities in which we work, which when combined very well, could easily help to, as it were, prevent or even control this condition of anemia that we are trying to look at. Some of the communities, when you go, you see very, very nutritious foods, trust me, very, very nutritious foods. So for me, I don't really believe, yes, food fortification is very good. It's normal. Yes, we know what it can do, because at least the micronutrients, we can get a lot of them, which could help us to prevent and to control anemia. But we all have to start thinking now about the diversity of our meals, because sometimes in most of our communities, or in fact, in most of our households, and again, when you look at the Ghana Demographic and Health Survey report, most of our diets in Ghana are not diverse. People eat the same type of food every now and then from the same source. For instance, in a particular household where in a community where I work, you see the richest in that community taking, let's say, akple or banku and pepper. And that is the only thing they eat for like a month continuously. Sometimes, because of where we find ourselves, we may not be able to appreciate some of them. But at the end of the day, when you go deep down into this analysis, you realize that people are really suffering for some of those things. So we need to encourage people. One of the ways that we try to look at that is to ensure that at least they have a lot of food samples available. How can we ensure that that is available if they always complain to you that, okay, they don't have enough money to buy, or they don't have the purchasing power to be able to purchase food to ensure their dietary diversity? Then it means that you'd have to immediately get onto another gear by talking about how available their own local foods can be to them. For instance, if you are talking about home gardening, that is also another way of ensuring that food is available all year round. But the home gardening may not work for everybody, depending on how your household and everything, or how your houses are also done. That also determines how you can have a bit of space to be able to do some of those things. But technology has also taught us that even within small spaces, there are ways that we can still approach some of those things. So for me, I don't believe, believe yes, food fortification is very good. It's normal. Yes, we know what it can do, because at least the micronutrients, we can get a lot of them. always have food around the aspects. And so our staples, our legumes, nuts, and seeds, we are talking about our animal sources, and of importance especially is our vitamin A rich fruits and vegetables and other fruits and vegetables. So important. So that at the end of the day, we are trying to encourage people to always have diversity in terms of what they eat. Of importance is the fact that we are not trying to say that, okay, somebody should eat 4-star diet at a go. No, but at least within the 24 hours, at least let's try and encourage our people to always eat at least little from here, little from here, little from here. So that at the end of the day, when they add everything up, at least cumulatively, we can easily see that we've taken food from all the 4 stars. And that is very, very important. But especially for kids, then that is for children, then we are always looking at the first 1,000 days of life. And so obviously we have to start from when development starts in vitro, through to early initiation of breastfeeding, through to exclusive breastfeeding, and then the use of the appropriate and timely complementary feeding where necessary. And it is at this place that the diversification that I'm talking about would actually kick in. But most as food samples we have on our markets now, some of them are fortified with very good milligrammage of the micronutrients, which can easily help to prevent some of these things. But the question has always been the affordability. And that is why the use of the locally available foods, whilst having the diversification in mind, would always be something that will help all of us. And then again, how to minimize nutrient loss is also very necessary, because as we know, most of these micronutrients, obviously, some of them are water soluble. And so obviously with the way we handle food and all those things, we can lose some of them. And so it's very necessary that all these things form parts of our education to them. I don't really subscribe to immediate supplementation unless or otherwise indicated, but it is also a very sure way of dealing with some of these issues. And we know how the supplementation issues have been in Ghana. I think currently, with the support from UNICEF, the Ghana Service is implementing the girls iron folate tablet supplementation for adolescent girls in school and out of school. And all the things are tailored at, raising the hemoglobin levels of these adolescent girls, because if you look at the data carefully, anemia among pregnancy registrants is very, very high currently. I think the last time we were around 55%. And that is so dangerous in the sense that at the end of the day, we know we know the effect of anemia on maternal outcomes. And so it's very dangerous that we'll be having that. But what it also means is that our women even are anemic before they get pregnant. And so if you are already anemic before you get pregnant, then the only window that you already have, you now have is going to be what you can do before you get to your 36, 37, or when your child is now at 10. But we need to look at it again this way. Sometimes when the HB, mild anemia, most of the time, pregnancy already would have conferred some level of anemia on you, obviously. But so with my experience, I noticed that mild anemia, obviously, let's say between your 8, 9, 10, it's always difficult to change. But when the person is severe, that one we are able to see some significant improvement on that. But be that it may, we need to now start targeting our women in their reproductive ages. As I indicated earlier, they are the people who are even abusing a lot of alcohol. They are also abusing a lot of substances now. And so that is how come the gifts, that is a girls iron folate tablet supplementation, has come to her. But what we've also noticed, for those of us who are so much into it, we've also noticed that most of them are not even adhering to it. Why are they not adhering to it? So we need to be able to answer some of those questions that come with supplementation. Yes, supplementation is not a bad strategy. It's a very sure way of dealing. I always call it as the last course that you can go when it comes to some of these public health interventions. But we need to ensure that it works very well. Apart from that, obviously, infections are one of the precursors of some of those things. And so we may need to look at improved health services and sanitation. The service in which some of us work, even if you're in private practice, I'm sure some of these things come in handy. A lot of people try a lot of governmental agencies and non-governmental agencies distribute early lines all over to prevent malaria. There has been a lot of malaria interventions. Even recently, the most curious of that is a vaccine that is now being rolled to most of the regions. All those interventions are aimed at reducing the incidence and then the prevalence of malaria among the population. However, how effective are some of those interventions? We give the mosquito nets to people, that is the LLIN. Some of them use it for fencing. They fence their gardens with it. Is it that they don't know the importance of it, or is it that it's just because they think they have enough of them, or they don't have enough education on it? Some people also wait a long time before they get into their rooms. And even in this period of the new Anopheles defensive, we need to now be careful and re-strategize about some of these things. So obviously, we need improved health services and sanitation. The health services in this case is how the practitioners themselves can be patient with the clients and counsel people. I have witnessed a lot of times, actually with our midwives, excuse me to say, where some of them just give the iron and folic acid tablets to them without really explaining to them. We need to explain the side effects to them. And so if they know the side effects, it's better. And especially so also the sanitation issues, we need to look at that, assess the sanitation and say, okay, the kind of water the person is using, because all these things have impact, or it has a direct relation or correlation with the development of anemia. In terms of the control, obviously, it's going to depend on the underlying diagnosis. So, for instance, if it's an IDA or a vitamin B deficiency or any other one, depending on the diagnosis that has been made by the medics, then that will determine how the control is going to be. But obviously, there are supplementations that could be done for IDAs and even for the vitamin Bs, or the 9s, the 12, and co. There are always supplementations that could be done. Blood transfusions are also available. We know some of those things already. Medications also to induce erythropoiesis can also be done. But of importance is a dietary. And so for this one, as I indicated earlier, for me, the important thing about this dietary is to always look at the underlying causes and not even the immediate causes. So after looking at immediate, kindly also look at the underlying causes, because society has a lot of rules. Society is almost like a political party. And so whatever the socialization of the person would obviously determine the habits of the person. So if you are going to change the habits of the person, if that is the reason why the person developed that, then obviously you need to analyze what habits, what practices, and those practices or habits are all enshrined in the socialization or the cultural beliefs of the person. And so we need to kindly pay attention to that. But obviously, I'm sure we are all aware of the dietary aspects of these things already, the heme and the non-heme ions, how to combine them. And so I will not belabor some of those things, but would have to look at our inhibitors and the enhancers. This is where the role of the dietitian or the role of the nutritionist will really help us, because at the end of the day, most of our mothers, I took up this thing for about 3 years now, trying to organize nutrition clinic for specific targeted people. And it is yielding a lot of results. So we look at some of the specific inhibitors and some of the specific enhancers, and tailor it to me, because some of them, frankly speaking, they just don't know mostly about some of these things. And so it takes somebody, a technical person like a dietitian or a nutritionist, to be able to bring some of this particular technical aspect to the fore for some of these clients, so that they will know that, okay, if you combine this with this, it's going to be a bit dangerous for you. Okay, so you think that, okay, you are eating this, you are taking this, you are taking a lot of green leafy vegetables, you are taking a lot of soupy foods, but unfortunately, you are not doing a lot of the enhancers, and so your iron is not available. Okay, so you are taking this, but these are the ways that you can deal with this. So these are the things that I feel that should always be part and parcel of our skill set going forward. As I indicated earlier, and I'm almost ending, I'm looking at it from this perspective. especially concerning the supplementation. A lot of people have complained about it. And so if we are dealing with supplementation, like I said earlier, we need to take into consideration a lot of issues. For instance, how many of us are able to explain the possible side effects of some of these supplements to the people? Most of them, not as I have observed in some of the communities I've worked in so far, the nurses will just give, or the prescribers just give some of these things, or some of them even buy it over the counter. And if you look at what they do, at the end of the day, if somebody experiences a side effect that he or she wasn't aware of initially, it's highly likely that the person would feel demotivated to continue. And so you realize that there is so much non-adherence to IFA supplementation, even among our pregnant women. And sometimes also disease conditions. So obviously, with a lot of frequent vomiting, people tend to get demotivated when it comes to some of these supplementation issues. And sometimes the duration of intake, if I'm going to be taking this once a day, even for those of us who sometimes during disease conditions, we have to just do even a 5-day antibiotic treatment, you notice that we at a point we feel discouraged because you're like, no, this size of tablet and this duration of the intake, obviously it's highly likely that clients will get demotivated. Even for the control of anemia among adults, imagine we are going to be between 2 months to 3 months at least, we can have a recovery from some of the means, and even for pregnant women situation. Sometimes the number of tablets to be taken sometimes also deters our people. In most of our settings, we don't have that one tablet that contains the elemental iron and then the folate. So we are made to do with what our community people call red, gold, green. So you have your fesolates, your folates, your multivitamins. Those are the ones they call the red, gold, green. 200 milligram of the fesolate, 0.4 of the 0.4 microgram of the folate, and then multivitamin about 10 milligram. But sometimes the numbers that they have to take at a go is not an easy thing. So it could also demotivate them. And sometimes too, supplements are not readily available. I can make a case for the program that is a girls iron folate tablet supplementation. I think well around 5 months, 6 months now, until recently, that was just like 3 weeks ago, that the supplements came into the system again, because some of these things are also donor funded. And so sometimes they are just not there for the people to have access to. So all those things could also be a barrier or a bottleneck when it comes to the supplementation issues. But again, this one is so crucial to me. The fact that in some households in Ghana, and again, backed by data, some mothers share tablets with other members of the household, and so they're unable to complete the dose. It's just similar to a particular household where we normally use our children to get favors from visitors. At the end of the day, you have the situation where a mother is supposed to take, let's say, a mother is given a 1-month course, and so let's say the woman takes this one and she feels demotivated already, but sometimes it's a whole household thing. Oh, me too, I want some. So the man takes, other people in the house would also take. At the end of the day, there's a lot of competition over tablets. And so the mother would obviously not have the complete package to be able to. These are specific things that happen in our community. And that is why earlier I said, my job today is just to bring to your knowledge some of those things that are silent yet are very important that we need to consider when we are looking at anemia prevention and control. For prevention and control, obviously, we all know, I believe, what we need to do. But some of those hidden or silent things that affect adherence are so critical if success of these interventions are going to be necessary. And so, few recommendations here and there. I believe so much that we would have to, again, look at effective counseling on the management of side effects. Like I said earlier, if people know about the side effects, then they are in a better position to be able to deal with it when it comes. And again, our health-seeking behavior is of essence here. We live in a part of the country where until people are sick, really sick, they wouldn't like to go for any checkup or anything. And so it is also supposed to be part of our routine where we encourage our people to always seek early healthcare, because the earlier we're able to do that, the better. And effective targeted nutrition clinics. This is a strategy that has been used by some of us, and it has really worked, because the midwives alone will not be able to deal with it. If you're a dietitian, obviously you are in your own space and you are dealing with this, they will refer the people to you. But sometimes in some of the public sector workplaces, you would, as a dietitian, as a nutritionist, you would need to now go to the maternity side and even look out the ANC side to even take part in some of these things. And so sometimes we need to organize some of these clinics specifically as nutritionists and dietitians. And then the availability of the supplements, we spoke about that already. Periodic orientation for our care providers. I've sat down, listened to some of our healthcare providers prescribe some supplements for our people, and I feel, no, that is woefully not the best. Sometimes the way the practitioners will talk to people, talk to the clients about what they should do when they have this, is still woefully not the best. And so we need to be periodically, as dietitians or nutritionists, I sincerely would like to and humbly like to appeal that once in a while we organize reorientation for the team on some of these things. I believe if we are able to do that, then we all can be or at the same level when it comes to dealing with anemia that has been an albatross on our neck for some time now. So effectively, colleagues, this is a perspective I would like to bring to you for the purposes of today. Anemia control and prevention is so necessary. The rates, the incidences, and the prevalence we are observing in Ghana is very high, just as it is in the world, but we can always make a difference if we look at the underlying causes. We can always make a difference if we go beyond the immediate causes and assess other factors that could easily be responsible for some of the acclaimed causes that we have. Thanks so much once again for listening, and I'll hand over to the moderator. Thanks so much.
Thank you very much, Mr. Teko, for that enlightening presentation. It's very interesting to know that it's very interesting to know that 42% of, as of 2014, 42% of the WIFA lived with anemia, and currently 55% of pregnant women actually have anemia, which is very alarming. And also tackling anemia from the community source or the community level, not just the clinical science. Ladies and gentlemen, it's time for questions and contributions and comments, suggestions as well. So you could use the chat room feature or the raise hand feature on Zoom. I'll read out the questions from the chat room. If you are willing to raise a hand to ask your questions verbally, you are allowed to do so as well. Okay, so there's a question here from the chat room. Great presentation so far. I'd want to know how effective is the Jehovah's Witnesses leaves in treating anemia. I believe the person is asking about the publications that the Jehovah's Witnesses print out and share. Mr. Tokpo, the question, should the question
hello.
come again? Hi.
Yes, please. Yes, please.
Okay. So the question is, I would want to know how effective is the Jehovah's Witnesses leaves in treating anemia. I believe the person wants to ask about the Jehovah's Witnesses publications that they print out and share.
Oh, okay, okay. Well, initially when I heard that, I was a bit alarmed,
But
yeah, I was
yeah,
a bit
I was a
alarmed
bit alarmed
because it was
because
placed in
it was placed in.
some inverted commas. So I was like, hey, this Jehovah Witnesses thing, people shouldn't bring into quote religious things into conversation. So that it's understandable. So I would like to first and foremost ask, well, I think you were trying to explain it a little, Barbara, about the whole Jehovah Witness thing. I don't know if the person who asked the question can kindly explain it a little for us about Jehovah Witnesses, because it means he or she knows specifically what the Jehovah Witness
All
leave
right,
is.
Lexus
That I'm
Kate,
sure.
please, what do you mean
Please,
by
what do you mean
Jehovah's
by
Witnesses?
Okay, so good afternoon.
Good afternoon,
Good
sir.
afternoon, sir. Okay, so what I meant by the Jehovah Witness leave is it's a particular leave that is being recommended in treatment. It's not the pamphlet that they do print out. It's actually some kind of leave that is being recommended, and I've had quite a number of people like asking me about it. So that's the more reason why I asked this. So it's not that is being printed out, but plant leaves.
Oh, okay. Okay. So Barbara, you see, at the end of the day, and I'm sure he has brought some clarity into the question. Yeah. So thanks so much, Alexis. First and foremost, I would like to humbly say that I don't know much about the into quote Jehovah Witness leave. I'll be more than willing to have the actual name for that, and then I can easily look at the data that backs that. For some of us, we believe so much in data, and so as long as a thing is not scientifically proven, it's difficult for me to really say. So frankly speaking, I've not had access to that particular leaf yet, but as if I have access to it, then I can speak to it. So I don't know much about it. I don't have data, any scientific data backing the Intuko Jehovah Witness leaf. But if somebody on the platform have seen it before and has access to that scientific data, it's a learning platform, so the person can easily educate all of us on that. Yeah.
Okay, thank you, Mr. David Tekro. So if anyone has information about the Jehovah's Witnesses leaves, yeah, free to comment on that. Meanwhile, your questions are also welcome. Questions, comments, suggestions, points you want to raise. Okay. So someone is asking, what do we do with tin tomatoes and Coke? There's this notion out there that tin tomatoes and Coke helps with anemia. What do we do with that?
Oh, okay. Thanks so much. Most of these things, sometimes I try to shy away from commenting on them because most of them are just not backed with any scientific data. They are just things that people feel. When growing up, people will tell you, okay, if you're able to take malt and then milk, if you mix it very well, how thick it is, it means that you have more thick blood. These are some of the things people say. People will now come and tell you tomato paste, mix it a little with margarine, you put on weight. Those are fat things sometimes. So for me, with my experience, I now decide, or I've made up my mind that as long as I don't have scientific data on the thing, I don't really speak on that. There could be a semblance or some iota of, I will not say scientific facts, there could be a little bit of truth in some of those things, but specifically, as long as I don't have scientific data on it, I wouldn't like to jump to that defense. But just to add that sometimes our local people are able to combine a lot of things based on their own folklore knowledge. And that is what has affected a lot of people for now. You would realize that we can easily do a lot of concoctions for some of our people, even when they are anemic, even when they are malnourished, or even pregnant women that are anemic. They would, when you go to the hospital and they prescribe some specific things for you, you have some political parties in the house, into quote, political parties into quote in the house, who will now tell you that, no, those particular medications are not good. We have a specific thing for you. When we cut the bark of this tree, mix it with this particular spice, and then mix, when you do it well, everything will be okay. And we have those situations a lot of times. I have seen people coming up, to say that, okay, if you are pregnant or when you are lactating, you should take into quote, oblayo, and then or so mix it with milk to do this for you. But we all know that milk is very low when it comes to iron. And in fact, even milk can even be an inhibitor to a large extent because of its calcium content to iron absorption. So some of those things, we just need to take our time and look at it. So once again, when it comes to tinned tomatoes and those things, I don't recommend it for people as something that they should use to boost their HB. No, if it's about turkey berries, yes, we have data on those ones. And especially, so we all know that if you're using the non-heme sources of iron, then obviously you would need a vitamin C around that could ensure that the iron becomes bioavailable. So that one is clear, and other mechanisms that can be used to ensure that iron becomes bioavailable is clear. But what is not so clear is whether tinned tomato in itself can boost HB production. I don't have scientific data on that, and I shudder say that it may not be. There could be other factors responsible for that.
Okay, thank you very much, Mr. Teko. There are other questions in the chat room. So someone is asking, how do we manage anemia in people living with kidney conditions as nutritionists and dietitians? Hello?
Yeah, hello.
Hi, please, did you hear the question?
Yeah, Barbara, I think the network was a bit worrying at my end, so I couldn't really hear that.
Okay, I'll take it again. Someone is asking, how do we manage anemia in people living with kidney conditions as nutritionists and dietitians?
Oh, okay. Yeah, so obviously, I think for chronic diseases dealing with maybe cirrhosis or renal dysfunctioning, that one is strictly a clinical thing. And so obviously the first point of call would have been to approach it in a very cool and a very slow paced way. You don't force some of those things. We need to first and foremost look at dealing with the kidney issues before we even moved on. Like I said, it's a very, very technical and tactical aspect. I remember the last time we dealt with somebody like that, unfortunately, we lost the person. Again, we need to look at a lot of factors that could form part of how we proceed on that. For instance, is the person on dialysis to begin with? Those are some of the things that we need to answer. If it's just an acute one, it's easy. with some of the very chronic one that even maybe the person is currently on dialysis, that could also be transmitted. A multifaceted approach together with the nutritionist or dietitian and then the medical officers who are in charge of that particular case to ensure that at the end of the day, we don't lose the person. But like I said, depending on the severity of the kidney infection, there are a lot of ways that can be done. And for instance, I know so well that even in dialysis, you may be giving an IV iron supplement. It's a possibility for people who are even on dialysis. So we need to identify at what stage the person is and how we can proceed on that. But that person would have to be under strict clinical monitoring, before we can see the headway out of that. Thank you.
All right, thank you very much. I see Nana's hand up. Nana, please, you're free to talk. Hello, Nana. Hello. All right. So there's a question. Before we continue to the next question, kindly note that the attendance list is in the chat room. So you kindly click on it and then you fill it once. Please don't fill it more than once. Thank you. All right, so there's a question about dairy products. That these days there are lots of dairy products on the market. So what do you say about dairy products and the non-dairy products in helping to prevent anemia? Hello, Mr. Teko. Please, was the question clear?
Yeah, hello. Yeah, Barbara, can you hear me?
Yes, I can hear you, please.
Oh, okay. I think my internet keeps going on and off sometimes, so it's difficult sometimes following precisely some of the things there. Okay, so I think you were asking about, I overheard something like dairy products. Okay, so at the end of the day, as I indicated earlier, some time ago we were told that if you take a lot of milk with tinned tomatoes, you are going to have a lot of blood in your system. Then the narrative changed to you taking a tinned tomato and then what's the name? Coke. And some people now use tinned tomato and then they'll use some of those sequences here or turkey berries with it. So we all have various perspectives on some of those things, but the important thing, as I keep mentioning, is that, for instance, we all know now that milk, because of milk generally is quite low when it comes to iron, unless otherwise you may want to add some fortification issues around that. But however, even milk and milk substitutes, it's not really a good thing for iron deficiency anemia, especially since that one is the most popular one, so I can talk about that. So I will not subscribe to that, especially so because I know it's very low, and to some extent, if you combine it with other sources of iron, it will rather even inhibit it. And so something I will not readily go for when it comes to places or people or populations that are just looking for ways and means of dealing with iron deficiency anemia, especially. For other forms of anemia, it could be considered, but for IDA especially, it's not something I recommend. It's not something I go for. So that is just that. Especially, I'm talking about the milk products that we have on the market now. Those are the ones that I'm talking about currently. Even the formula, some of, I don't want to mention companies' names and all those things. Some of them, when you look at it critically, let's leave that discussion for another day. Because sometimes when I start it, I may go into it. I'm so passionate about some of those things, so I will just leave it there. So from Serum Alberta, I think I just saw it there. Yeah, so there are a lot of dairy products I understand currently. But for me, it's not something I recommend because of the things I explained earlier. Actually, for IDA issues, milk is not really your first point of call. So that is a little I can say on that.
All right. Thank you very much. Okay. The questions can still come, please. We are still open for suggestions, contributions, comments as well. Okay, so is animal food products still safe as a source of iron for anemia prevention, since most of the animal kingdom is diseased and sick? Today, only diseased beasts are slaughtered for human consumption. What kind of blood can we get from a diseased flesh diet?
Yeah, Barbara, this one sounds some way. Yeah. I remember that I was trying to cancel somebody on some of those things, and the person told me categorically that you poor, at the end of the day, you poor make us not to eat anything again. Because at the end of the day, we say consume a lot of dark green leafy vegetables. Yes, still we are telling you go for the organic ones. Now, the question I'm also trying to find out, okay, so the heme iron is always the best source of dietary iron for human beings, but then there could always be issues with the animal as well. And so it brings back the perspective of systemic things, systems thinking, systems strengthening. For instance, which people are responsible for ensuring that the meats that we have or the animal products that we have on the market are wholesome enough. So we need to be able to look at some of those things. I think I raised this question when I had an interview with Class FM the last time, and everybody was like, oh, really? Really? Yes, but we need to pay attention to some of those things, because at the end of the day, the people responsible for ensuring that every step of the food chain before it gets to the consumer finally is safe, everybody must be up and doing. Otherwise, dietitians and nutritionists or even health education people or health promotion specialists can broadcast a lot of key messages on some of those things. We all know that, yes, animal sources are one of the best sources of complete proteins. We all know about those things. But then, like what the person questioned, is it wholesome enough? Is it healthy enough? For that one, it will be difficult for me to answer because it is a systemic something. There are regulators that are supposed to ensure that by the time products get to your table, they are all healthy enough. So we can do, the best we can do is to ensure, just as we are currently doing on the sugar sweetened beverages by GAND, the SSBs, I think we can still take up that advocacy, to ensure, because yes, animal sources are good. Those of us who still want to do the vegetarian thing, it's not bad, but I've seen some people who attempted to switch to vegetarianism and they look malnourished at the end of the day. So, so it's not an easy thing. It comes with a whole lot of targeted and intentional way of doing things. And if you're not that disciplined to go about it, it becomes a bit of a problem. So for me, I think the best we can do is just to increase our advocacy and awareness creation on some of those things so that we all can be sure that at every stage of the food chain or the food cycle that we have in a country, we are having access to wholesome or healthy food products on our table. But animal sources still remain one of the best sources of heme iron, so we can't discount it, and that is very necessary. And also to finalize on that, I quite remember again in my practice, some people can just look at this animal and tell you, no, this animal is sick. But some of us too, with our practice, we may not know it. So how, even if you're the one who buys the live animal, how sometimes they can have some deformities or whatever, but it doesn't necessarily mean that they're carrying some pathogens. So the specific regulatory bodies would need to be checking some of these things as often as possible. That is the only way that we can ensure that some of those things, we can have healthy food available and accessible all the time. So I think it's a very nice angle to look at it from, but I think together we can succeed on that. Thank you.
Together we can succeed. All right, there's one other question here. In a clinical setting, a child is severely anemic and needs immediate attention with diet. What will be the first line foods to be used to boost immediately with all social interventions in place? Hello, Mr. Tekpo. Hello.
Yeah, hello. Yeah, hello. Can you please hear me, Barbara?
Yes, please. I can hear you clearly.
Okay.
Was the question clear enough?
I didn't even hear it.
Okay. Let me read that again.
Okay, please.
In a clinical setting, a child is severely anemic and needs immediate attention with diet. What would be the first line foods to be used to boost immediately with all social interventions in place?
Oh, okay. Okay. So if I hear you correctly, it means we are looking at a child that is severely anemic. And then also we are looking at the first line foods you mean that will be used to boost immediately. Okay. So first and foremost, the first thing we have to look at, or the first thing I will look out for, is how old is that particular child. At the end of the day, the dietary history of the person to begin, because obviously some children will not tolerate some things. There are a lot of first line foods that could easily be used for a child. And again, depending on what the child already is using, for instance, if maybe a child is anemic and maybe we are only trying to treat, let's say, the first phase or the stabilization phase of malnutrition, obviously we have to be very careful if we are introducing iron things, especially in the stabilization phase, if you are going to prepare a formula or something for that particular child. And so there are a lot of considerations that needed to come in handy first before we can easily agree on the particular one that we need to use for the child. But obviously, we are looking at things generally speaking. So this, and because it's not so specific, I will also go a little bit general. Generally speaking, we will be looking at things that would not increase further infections. That is the first line. There is no specific food that would immediately boost iron levels. At least not from my experience. There is no specific food that can immediately boost. It takes a lot of time and then constant food or dietary practice before we can get there. You can always, actually in the clinical setting, obviously, when the person is on some level of supplement, whether it's on IV or you are already using maybe your formula that you are preparing minus the iron things that we are looking at. But then you would have to look at a variety of things. So for instance, are you going to use some fortified food products, or are you going to use some of your dark green leafy vegetables? That is depending on the age of the child. So like I said, there are no specific food samples which are like first line food, especially in the clinical setting for a severely anemic child, unless otherwise we are able to determine how old that child is, what is the current situation of the child, what is the current dietary regime of the child. If the child is already on supplementation from our formula, then we have to hold on to some of the family foods for now. But when it comes to general family foods, there are a lot of them that are available, which I think all of us know about already. But there again, the only caution I'll throw on that one, the use of the family foods, which we all know, the dark green leafy vegetables and our heme iron sources. the only constitution we should have actually should be choosing the specific one that would not increase further infections in the system of the child. So I think that is a little response I have on that.
Okay.
Barbara,
So in effect, yes, sir.
sorry, this is Percy here. Let me just
Okay.
seek some clarification from Seriam, who asked the question about the clinical setting. So is Seriam able to provide some more clarity to the question so that we can be able to give more specific response? I think Mr. Tepo has done excellently in looking at it generally, but I feel she has a more specific ask, if she can clarify. Seriam, can you hear us?
Yes, please, I can hear you. Around where I live, at the clinic, we mostly have these Fulanis coming around with their kids, almost always anemic in severe conditions. So, and then we from the social intervention, we try to help them with some resources and the rest, and so you realize that even they are not able to meet those. And so in advising them to be able to use the immediate foods that they have to help themselves, that's what I was looking at.
So if I understand you, you are saying that this is a Fulani community. They have a good access to milk, I mean cow's milk and milk products. True?
Yes.
And then they always have HBs lower than 7 or lower than 10.
Yeah, even lower than 7.
So your setting is a community health setting, as in a CHIP center?
No, please. The Akuse Government Hospital.
Okay, so I am thinking that each case may be specific, may be individualized, but for persons or children with HBs lower than 7, I think the first line of call is a transfusion. And so if your facility doesn't provide transfusions, then because that's the surest way of immediately boosting the hemoglobin levels or the anemia level, or at least the how they call the blood levels to appreciable levels before the diet will actually kick in. No diet, as far as I am aware, maybe seniors on the call may advise us. I'm not aware of any specific diet, like Mr. Tepo said, that would immediately shoot your HB from maybe 5 to 6 in one day. So maybe the immediate intervention there may be a transfusion, maybe
so
back
the
or full whole blood, which is already done.
Yeah, transfusion is normally done anytime a set case comes in.
Okay.
So I was just thinking maybe there could be something else, there could be any food around that we could also use. That's why I was asking.
Oh, okay. Well, thank you very much. I think it's clear for me now.
Yeah.
I'm sorry for the intervention.
No worry, it's fine. And thank you also, Mr. David Tekpo, for that explanation. There's one question here. Please, how will you know if someone is deficient of folic acid, vitamin B6, B12, zinc, etc., as a result of anemia using the lab results?
Oh, okay. Wow. So for lab results, I think it's just straightforward. It's just straightforward. We can always do, if I understand the question correctly, we can always do a complete blood count. In some advanced jurisdictions, they would have gone for what we call the peripheral smear. I'm sure this one is much more about laboratory things. So by the end of the day, any test that you request for, obviously, normal ranges would obviously be given to you. And so you'll be able to see aforehand whether the person is suffering from this or not. But I know the ones that I have experienced, at least I know of the complete blood counts that can also give you, actually those of them like, I think I had that of the folic acid and then the B12. Because most of those ones are macrocytic, and so lab results are able to pick them quickly. And I know at least the normal ranges in nanogram per milliliters for folic acid, for instance. But some of those things too, I will kindly suggest to practitioners that don't be so fixated in keeping the ranges in your head. At the end of the day, before the person comes to you, the person would have already been diagnosed somewhere, or the lab people would have done their work, and MO has reviewed and they've referred to you as well. So you just have to deal with that. But for academic purposes, obviously, there are complete blood counts tests that are available in most advanced laboratories that can take care of that. Apart from that, in very, very advanced laboratories, you have the peripheral smears also that can easily take care of some of those things. But for deficiencies in some of the minerals, like zinc, sometimes some of the practitioners will tell you it's difficult to detect sometimes. And so when you place the person's response to the supplement will tell you whether the person is deficient. It's like a reverse kind of thing that is done. But it is not so well understood because we don't really know much about the mineral aspect, especially. So that is just what I can say for the B12 and the B9s. It's something that can easily be done. But for the zinc aspect, I know most of the time we have to use what the client is telling us to be able to determine certain things. And then also the response of the person to the supplement will also tell you how severe or how mild the condition is for the mineral deficiencies as well.
All right, so that means we are combining the person's history and then their lab results to determine.
Exactly.
Okay.
Exactly.
All right. Okay. Any more questions? Any more questions?
Yeah. Hello, Barbara.
Yes, sir.
Yeah, Prince here.
Okay.
Yeah. So if I think Mr. Tepo has done an awesome job. Normally when after presentation you don't have more questions, means that people have understood it, right? So if many more questions are not coming, you could also use the rest of the time for your zone to discuss key things, because you have other CPDs ahead of you, and how you can draw most of your people together. So if more questions are not coming, you can use that also for that purpose. Thank you.
Okay, so that was actually part of the plan. But thanks anyways. I would like to invite a national GAND member to give us a few words. But before that, Mr. Tepo, what are your last words for us?
Oh, so first and foremost, thanks so much for the opportunity. I'm happy to hear from a lot of my seniors also on the platform, specifically Mr. Percival Agodo. He's been my mentor for some time now. Mr. Prince Bedu, I've been admiring him from afar. Good to hear him again. So I just would like to encourage again all of us to always bring most of our people. I don't know why people are still, excuse me to say, adamant in realizing that where GAND is going is a national, international thing that would help all of us. And so I would just like to add my voice also to it. Yes, we can talk about anemia the whole day, but at the end of the day, if we don't come united, it will be difficult. And so we need to forge a strong force. And especially so, the last time I heard Mr. Percy espousing on where GAND would like to be, the short and the medium-term vision of GAND. And I realized that imagine that we have specialist courses that can be run by GAND, then it means that even this anemia that we are trying to deal with, everybody already have the expertise in that. Somebody can specialize in specific just anemia control, and that is a whole consultation and a whole branding for GAND, you see. So for me, I would like to encourage all my colleagues, seniors engineers, to see GAND as the only vehicle that can help to rebrand nutrition and dietetics practice in this part of the world. So thanks once again.
Thank you too for your enlightened presentation. All right, I would like to invite Mr. Percival Agodo. He's the Vice President of the Ghana Academy of Nutrition and Dietetics, to give us a few words about this whole zonal partitioning of GAND and any other thing you'd like to tell us.
Oh, okay. No, that is quite a surprise. Anyway, good afternoon, colleagues. And I would want to appreciate Mr. David Tepo for the wonderful presentation. I thoroughly enjoy the simplicity and the practicality of the conversations that you espoused. And I was just telling myself that, look, I've sat in at least all the ones that have happened, all the zonal ones that have happened in this week. I sat in the northern one. I joined the middle zone one. I've also been part of this one. I intend to be part of the southern zone. But so far, I've had different perspectives on the same topic, and it just makes me realize that yes, we actually have a very strong workforce, a very strong professional base of very intellectual, very experienced, very astute dietitians and nutritionists across the country. And we have what it takes to make GAND what we all envision it to be. I just want to appreciate you for the effort. So far, you are the only non-professorial speaker I've listened to so far. I mean, as far as this anemia topic is concerned, and hands down, I can say that you brought the practicality to bear on this, and I want to acknowledge you for that. And if you can all hear me, I wish we could clap openly, but I really want us to encourage him with an e-clap, and that's a very good one. Very, very insightful. Yes, I agree with you, Joyce. Very good one. I just want to bring you greetings from the national governing board of GAND. The goal of this CPD is to ensure that we get to know ourselves more. We hope that together we can get to catch on with a vision to build a national professional body that seeks our interest. You see, this is not a prepared speech, but I just want to say 3 simple things, and I hope you will remember them. Number 1, GAND is not an association. GAND is not a group. It is not a gathering of nutritionists and dietitians, or it's not just an assembling of people. GAND is actually a professional body. And I want you to remember that, because the more we fail to understand the positioning of GAND in the scheme of things, the worse our attitude, or if like the less impactful we will see the power of GAND in making our lives better and our professions better. So GAND is a professional body registered by law for that same purpose. So it's just GAND, in the face of the Ghanaian law, is equal to the Ghana Bar Association. It's equal to the Ghana Medical Association. It's equal to the Ghana Pharmaceutical Society. Now, these are the bodies that determine for each profession, the various professions I've mentioned, the scope of work, the scope of practice, the scope of professional engagement. So in other words, the fact that we have been late in coming onto the scene does not mean that we relinquish our power to just anybody else. In the absence of GAND, the Ghana Health Service, the Ministry of Health, and any allied professional group has been acting, just like the way it has been for every other place. So today we know that the most senior nutritionist in Ghana today is the director of nutrition. He's actually deputy director of nutrition. That is about how far we go in the nutrition space. In dietetics, the most senior dietitian is the chief dietitian, and in Ghana there can be only no more than 6 or 7 of them at any given time. But that is in essence a job position, a job classification. It is not a professional rank necessarily. It is just the employer who has created promotional ranks for us, because any place where there is no promotion, you really can get stagnated. So the essence of GAND as a professional body is to help us to get the professional credentialing. It's a professional credentialing that gives us the impetus, if you like, the impetus, the power or the authority or the autonomy to practice independent of any professional grouping. So by that doing, being a professional body makes us know, it makes gives us the authority to practice autonomously. In other words, we can take our own decisions as professionals, and we are liable to them, and we are responsible for what the outcome of our patients are. So please remember that we are not an association. So Ghana Dietetics Association was an association. The Ghana Nutrition and Association was an association. In fact, the same is the Nutrition Professionals Association of Ghana, NUPAC. Those are associations. Associations, we have a choice to join them. You can choose which association you can join, but by the laws of Ghana, you don't choose which professional body you will join. If you want to practice any profession in Ghana, you must by law be a member of the professional body once that professional body exists. So GAND only came to being in 2019, but once by law the professional body exists, we are all mandated by the law to be part of it. So ignorance of the law really is not an excuse. But since 2019, we have been quite Mr. Bedu is here, so let me borrow his word. We have used the human face approach. That these are our own colleagues. We want our colleagues to voluntarily join the movements to build the professional body. But I can assure you that human face will soon, there's a phase to it where it will end, and where we may have to take the very painful but difficult decision to persecute people who fail to be properly aligned with the professional body. We hope and pray that it doesn't get there. But the only way we can ensure and protect our profession, none of us here can get up and go and practice medicine simply because we know something about some drugs. If there's anybody like that, let me know. Where you can say that I can go and say that because I have worked with nurses all my life, I qualify to be a nurse. You can't say that. Or because my father is a lawyer and I've read his law books, I can go and stand in front of a judge and defend a client. No, you may have the skill, but once you don't have the proper professional credentialing for that purpose, you are actually what we will call a quack, a QUACK. That's what quacks are. So quacks are people who practice professions for which they do not have the right professional credentialing for. So that's the first thing I want you to remember. We are a professional body and not just an association. The associations are the Ghana Dietetics Association, the Ghana Nutrition Association, the Nutrition Professional Association. So please, let's disabuse our minds. We are not in competition with anybody. GAND is not in competition with anybody for relevance. GAND is a dream that we've all put together to protect our profession. Because if we don't do that, I know, in fact, in recent times, you've seen how there is a battle between the medical laboratory sciences and then the physician laboratory science, how do you call it, laboratory physicians. Now, there are people sitting in high places seeking to usurp the power of professions and make them their own. I don't have to say it openly. I'm sure you understand what I mean. So there are people who have sat down, they've planned, and they are strategically trying to take over every profession that has the power to limit the scope of authority that they once had because we didn't exist. If we want to continue that way, very soon we will become the highest you will ever get to will be assistants, or if you like, deputies to these people. And there are professions that we know. I can mention them. There's a profession like radiography, or is it radiology, where the one who actually does the job and handles the equipment will finish and produce results which he or she cannot sign off. Somebody else will have to sign off and now make those results authentic. That is where we are going to, and that is what we are trying to avoid as GAND. And I'm praying and hoping that we will all wake up to this realization and see GAND as the professional body. Number two, which I want to say, is that we cannot do this alone. We can only do it with our numbers. The last time I checked, in the 2022 Allied Health licensing group, the same way when Allied Health started, they are always late adapters. They are always early, the visionaries and the late adapters. People would have the wait and see attitude. By the time people woke up, realized that what was happening, Allied Health became a requirement for promotions. Now it became a requirement for advancement in your salary. And so now people are rushing for Allied Health registration. But when I checked last year, there were close to 2,000 nutrition and dietitian professionals in Ghana. 2,000. It's 1,700 and some coins. But I know that not everybody got a license. So we can safely say that there are about 2,000 nutrition and dietetic professionals in Ghana. But of these about 2,000 of us, we are still not enough for the Ghanaian population. But nobody is going to mind us if we are not organized between ourselves. Now, and strangely, or is it interestingly, we are not the only professions in the world and in Ghana that have two main streams. Medicine has the doctors and then dentists. The medicine, internal medicine and dentistry is two groups in one. Nursing has nursing and midwifery, 2 groups in one. We are nutrition and dietetics. So people have already showed us the way that it is possible to have 2 distinct groups that work together for one purpose. And that is why it is important that we make sure that we reach out to all our numbers. I would have expected to have at least 200 people on this call, which is just for the Volta Oti Eastern regions alone, because there are up to over 200 people in these 3 regions who are nutritionists and dietitians practicing, and even, of course, people joining from elsewhere. And I expect that when we have a national event, it should be no less than 1,500 people in attendance. This is only possible if we all become torchbearers of the vision to make the professional body, not professional association, work and work well. I think that I have said a lot of very difficult things, but I pray and hope that we will all rise up to this call. We will all make this possible. I want to finally commend the executives of the zone for leading us and showing us the way to do it and guiding us to make this possible. I look forward to our physical meetings in the very near future, and I pray that when that time comes, we will all be there to make it a dream come true. So Barbara, on this stage, on this note, I want to hand over to you. If there are any comments for me, I'm happy to respond to them. And thank you for inviting me to speak.
All right.
Bye-bye.
Thank you very much. Thank you very much also for responding to the invites, and we are ready to be torchbearers for GAND. All right. Do we have any comments from anyone? It could be the zonal member or a national member. All right, I'll use this opportunity to say thank you for all the national members who joined and any other individual who joined. Also, the zonal members, thank you very much for joining in your numbers to listen to this insightful presentation. In the absence of any
Hey,
questions.
Barbara, does that mean nobody is going to say anything after I've spoken? Hey, that is not too nice. Somebody must talk. You are either too confused or too convinced. It
Yeah.
cannot be.
Hello, Barbara.
Yes.
Hi, Sarah.
So I thought you were just asking us to comment on what the statement that were just made right now from regional president or our national president. Yeah.
National.
So for me, the zone we are supposed to have a meeting. That's on the 3rd and then the 4th. So if the president our president to quickly tell us something about it so that the members who are attending now will be prepared towards it, and then we will see the way forward about that meeting. I think it will be laudable. On our platform, majority of us don't contribute or come in to say anything. So I think as we have met now and majority of us are here, it will be okay if we can chit chat a little bit and know what the problems are so that we can quickly mobilize ourselves and prepare for the upcoming face-to-face meeting.
Okay. Thank you very
I'm not sure who
much.
just spoke,
Right.
but is that Sarah?
Yes, please, I'm the one.
Sarah, I think that was a very important conversation. Is Justice still on? I think he is, isn't it?
It is, but unfortunately, he's unable to speak right now. So I'm pretty sure he would put more information on the platform. But among us here, we could, as she already suggested, we could chit chat among ourselves and see the way forward. Although the president would definitely put information on the page for us.
Hello.
Hi.
Hello, please. I would
Hi.
like to say something about the face-to-face that we are going to have next week. Hello.
Yes, please.
Hi,
Can
please,
I
you're free to
tell?
talk.
Please, everything is on course. God willing, we will have it on Thursday. That's the 4th of May. And instead of the 2 days, we have merged all together because of facilities issues and we want to cut down costs. We have decided to merge the 2 days to one and have 4 hours straight. So far, that is the arrangement ongoing. That is it for the face-to-face aspect. Thank you.
All right. Thank you very much.
Barbara, please, can I talk again?
Yes, please, Sarah. You are free to talk.
Okay, so as at now, I know we haven't gotten a venue yet. So as members of the Volta Oti Eastern region, I wish we could find out among ourselves if maybe anyone can arrange a conference room. So that, we are looking at cost and everything. So if anyone could quickly link us to maybe a restaurant, a hotel, or a conference room that we can go speak with the owners and if it will be given to us.
Hello.
Hello.
Please, the venue, everything is set. So don't worry, everything is set. Everything is on course. We have gotten a venue. So I don't think there is any challenge there. Yes, please.
I was so worried about
Yeah,
that.
we are. I hope this evening the president will come to the page. So don't worry. Okay. Everything is okay now. We have gotten a venue, nice one, of course. Thank you.
Can I ask an open question? Given that we have started discussing next week's event. So For the zone, what would be the most central location for the zone? Is it Ho or Kwahoe or Koforidua? It's an open question to all of us, actually.
I think it should be in Ho.
Okay.
I think it should be in Ho.
Okay. And then if people from the other regions will have to come to Ho for a 2-day event, what is the implication for logistics for the individuals? If we can share, particularly those coming from.
Pearl made a comment about having the 2 days at one. And so the organizers are planning of having a 1-day program instead of 2 different days.
Oh, okay. But okay, that's fine. That's fine. But I want to be clear. For those of us coming from other regions, OT and Eastern, do we get the power to, or do we get our facilities to sponsor our travel? Is this something that happens to everybody?
Uncle Percival, please, the issue is this is the first time we are organizing something of that nature. So like making arrangement for accommodation for people to come and sleep over has not been done. And I think going forward, we have to consider all those things into our budget. But for the start, this is the first time we are arranging something of that nature. So after this, we'll sit down and analyze the pros and cons and see the way forward, how we can improve on it. Thank you.
I appreciate that very much. Thank you very much. Yes. So I'm aware that well, in the past, we've always had, if you get letters from the academy, we are happy to support the letters to your facilities so that they can provide sponsorship to you. We've done that in the past. We usually write to the Ghana Health Service head office, and they will normally add a memo to that effect so that practitioner, in fact, it's actually one of your benefits as a professional.
If you had to call me when she's back, she wanted to talk to me, but I'm still in a meeting. I'm going for another meeting. I think she wanted to talk to me.
Okay, so it's actually one of your entitlements as a practicing professional to have your institution, your facility, ensure that you have continuous professional learning. But then the fact is that there's a caveat. They say based on the availability of funds. But the truth is that if you don't request for it, they will not bother to provide it. So if you need that, it is okay to let us know in good time so that the officers in charge can provide the right letters to that effect. Okay. I think I am done speaking for now. Over to you, Barbara.
Okay, thank you very much for that. Do we have any more comments or suggestions from anyone from the zone?
Yes, please.
Okay, Nana, you're free to talk.
Yes. Yes, so the name is Nana. Yes, I think that from what Pearl just said, Auntie Pearl said, and what the person just spoke about, I think it's important we just get the letter and then give it to them way forward to the facilities. So in case where some are able to sponsor, fine. If not, there's still another time. But even although this is the first time, but I still agree that there should be some drafted letter so that we'll try this time around for better days to come. Thank you.
Okay, you're welcome. I'll note that for the president. Do we have any more questions, suggestions, comments? Okay, since the whole place is quiet. Hi, say.
A few things to note. The zonal leaders are not presidents. The GAND structure, we have only one president, and then we have the zonal leaders, right? So the Volta Oti Eastern Zone has a leader, right? So I think just so that it doesn't confuse us. Along the line, when we were saying president, I was wondering whether it's the GAND president or it was confusing me. So I think let's designate them very well. Yeah, and also the letter will not be individual letters. We are writing an official letter to the GAND members that this year this is going to be our CPDs. So it is the facilities, the GAND members in the various facilities that will have to add a memo and attach our official letters to it to go and request for the money or whatever resources they will require to go for the to attend the CPDs. So by close of today, we will have the official letters to all the zonal heads. So once they have it, the zonal members can have it also and do whatever you are supposed to do so you can get your facilities to help you attend the subsequent CPDs. Thank you very much. I must say that I've enjoyed the CPD. Keep it up, and God bless you all.
Thank you very much, Prince, for those comments and the correction. All right. Do we have any more comments or questions coming in from any member, be it national or zonal? Okay.
Yeah.
Okay.
Hello.
Like this, K? Like this.
Yeah, so what I want to say is that I think since it's now that we are going to receive the letters, I would also plead with the leadership if the registration, I think there was some time ago that we had info on registration for the entire CPD throughout the year, which was I think somewhere around 200 cedis or not a year. So I'm also pleading with the leadership if that could be extended so that probably after submitting the letters, if that could be catered for.
Lexis.
Yes, boss.
Okay. Now, from experience, when you send your memo to the administrator or the medical director, it will take some time before the approval is done. So usually what happens is that the professionals we pre-finance, yes, then we get, well, when they bring the money, then we take it back. So that it is from that backdrop that we decided on the deadlines for the registration. And that is how come also we did our very best to bring the yearly CPD to 200 for the whole year. You know, usually it's not like that. You can't run a 58 or 60 CPD point at 200 CPD. So we did a lot of thinking into it. So please, I know you have registered, right? Lexis.
I'm here to register for the entire year, but I'll register. That's why I'm asking for extension of the deadline.
I realize
if that's possible.
Those who had a lot of money, who didn't really want to register, they wanted to give us more money by paying 50 cedis per. Yeah, thank you so much.
Okay. Lexis K, you still have your hand up. Do you want to say anything else? Okay. Is there anyone here who wants to say something or ask a question? All right. So since there's no comments or questions, would like to come to a close on the CPD program. We can say it was a successful one. And thanks to everyone who joined, be it national or zonal. Okay. Have a great day, everyone. Thank you very much.
Thank you to Barbara. Thank you very much.
You're
Thank
welcome.
you,
Well,
Auntie
and well
Barbara.
done. Well done for the excellent moderation. Are you cool?
Yeah.